Do you suffer from neck pain or neck stiffness? I'm Dr. Evan Schwindt. Today we're going to review an exercise to help improve that mobility. Today's focus is neck mobilization through an exercise called Mulligan Mobilization with movement. So this is all about moving the spine, mobilizing specific segments through movements that maybe you're currently restricted in. Now, this may be prescribed to you from your healthcare provider when they notice a specific recurring stiffness, or you might just notice shoulder checking over one side, or looking down to the ground, or looking up to the sky. Any of those just feel like a block. You can't move beyond that. This is where the Mulligan mobilization is a beautiful thing. We're going to go through 3 different variations here. Again, this will be specific to your own mobility needs. You don't need to go through all these if you aren't feeling a restriction. I like to use, this is actually like a Mulligan strap, but you could also use a belt. You could roll up a towel. But you do want it to be pretty thin. If it's thick, you're going to quickly notice this is a very challenging exercise to get the proper traction on. So we're going to use this strap here. First off is going to be flexion. So again, this is, hey, maybe I'm having issues going down. I just feel super locked or tight. So I'm going to be having this belt on my second vertebra. So pretty much the top of the belt is going to be resting on the base of the skull. And that's going to put the apex of the pressure as I come forward on that second vertebra. I want to pin the second vertebra and come forward. I'm going as far as I can, applying a little bit of an overpressure. Critical to note, like so many exercises, making sure that we do say this is about mobilization. If you have pain, stop. That's not what this is about. This is about improving a pain-free but tight movement. So again, holding there. Oh, and I also don't want to create a shoulder issue, so lock those shoulders in and pull forward. Hold at the very end, give it a good 5 seconds, and then come back up. So that's flexion. The next variation is going to be for extension, if you're struggling to look up. Now for this one, it may be any variety of segments, so you might find a specific point that you feel tight. Otherwise, you're going to be slightly below where we just were for flexion to start. And for this, I'm pulling my hands forward. With this going forward, it's going to pin the vertebra and allow the above vertebra to extend back over top of it. Okay, commonly we actually can't extend back because we don't have segmental movement. Our spine's moving all together. So this is going to prevent that from happening. Pulling forward as much as I can, and then extending back. Pull for about 5 seconds, maybe do about 10 reps, but ideally more so until you feel that freedom of mobility. So now we've done flexion, we've done extension. We're going to get into rotation. So think about shoulder checking. Maybe you're feeling a bit more restricted from that. Maybe this is after a car accident, you have whiplash or a concussion from that too and have some whiplash. This one gets a little bit more tricky. We want to make sure we do not create any issues and pain and tension on your jaw. So I've been nice and even like this. Now I'm going to switch my positions. I'm going to go into some left rotation here. I'm going to take this hand up, and I want to make sure it's above my jaw, just on the upper part of my ear, pulling this way, okay? Now, what is this hand doing? It's also locked in against my side, pulling forward. So that's going to lock the vertebra, bring it forward, so that way we can get the segmental movement. It locks. I'm turning my head to the left as far as I can. Once I stop, I apply that overpressure at the very end. And it's important that you do the movement yourself. You're not just doing a passive movement. I'm actively going as far as I can. And then this allows an overpressure for that little bit of extra movement in a pain-free motion. Just to demonstrate the other side. Pulling forward on my down hand there. This is up, not on my jaw. Turn to the right. Pull that way. All right, I hope you enjoyed the video. Thanks for watching.